So again, I think that the biggest impact has been with the learners, and it's really difficult to start to learn how to have that conversation in a flowing and efficient way. And this really does lay out a nice structure for someone who is more nervous about that conversation or may not be as confident in their knowledge to be able to know that I'm hitting these points. The problem comes in this tool when the person delivering this discussion can't get off that track of being able to hit all the points and be able to deviate to what the patient needs or the conversation that they need to have. And so the comfort level of the person leading the discussion needs to be able to actually sway a little bit so that you're not just, going down your checklist. I think the first decision is whether they're going to do dialysis or not do dialysis, and that's really the strength of this tool. Once we get to the place of, yes, we think dialysis is an option we're going to choose, then talking about the specific methods and what it is that's going to happen and what they might be best qualified for seems to be a little bit different conversation for me, and so I don't seem to think about that as much. I think the strong point of this is to be able to first have that conversation that dialysis is the right tool or is the right procedure that they would like to continue to use or would like to initiate.
And that ends up saving me the time that's needed to allow that conversation to happen. Or I'm specifically setting up these visits for that conversation, which is another way that this could be approached.
And how do you approach the tool when you're thinking about, you might not know the method of dialysis that they're going to be using versus, PD versus hemodialysis? How do you judge that best case, worst case based on that?
Yeah, so I certainly think best case, worst case can be used in either setting, whether we're looking at home dialysis or in-center dialysis.
Because I have had people talk more about the two lines, and here's where I think I am. And so the fact that they still have that mental image in their minds is something that they can continue to think about. That's probably a good value point that I wouldn't have expected.